Hello again. My name's Bamba, Jim Bamba, and I'm here speaking again today on behalf of Life, the Basic Manual. This is the third part of 4 little talks about living with cancer. In the last small talk that I did, I went through all the operations that I've had, 5 in all, and I also stressed about men of age 30, age 40, age 50 and upwards. I urged them to go and have the specific antigen blood test, and all you need to do is ask your GP for that and have it every 3 months, every 6 months, doesn't matter. So in this little talk, I as a warning for you to go and have the blood test, this is what's happened to me. I've had these 5 operations. The first one was to remove the prostate altogether, and that is a major operation. I believe it takes about 5 hours. And they open you up from your tummy button down, and they remove the prostate gland, which is just behind your pubic area. And I had that done in Blackburn Hospital, and of course I was full of fear to start with, but another patient there who I will be indebted to for the rest of my life kind of took that away because he'd had it already. And when I go into the last part of this series, I'll be talking about the therapeutic value of people helping each other with this, because you don't get a lot from the NHS. Surgeons don't talk a lot. They have other skills. So yes, radical prepubic prostatectomy. I had my prostate removed. I got home in a lot of pain. I had the district nurse come round to change my wound bandages. I also had a catheter in, which was the first time I'd ever experienced that, and had to empty that out every night, etc., etc. And then about 9 months after that, my surgeon had told me that he tried his level best to get all the cancer from the gland bed. They call it a bed, but he didn't think he'd got it all, because my prostate gland was chock-a-block full of it, and this is why you need to go and get the blood tests again. I got a pain in my left testicle, and it started to swell. And this is when I came up against the word metastatic, or metastasized. My cancer had metastasized, which means it had started moving around my body. It wasn't just in one place. Cancer is a very strange thing. You can have it in your big toe like Bob Marley, and then behind your ear. And so I had to have my testicle removed, my left testicle removed, which is, by the way, called an orchidectomy, which is very pleasant. Apparently that comes from the Greek, and if you're stuck for something to do on a weekend, if you dig an orchid up, apparently it looks exactly like the male scrotum. By the by. Now at this stage, I talked about the diagnosis and afterwards, and we talked about being very sure about your choices and the choices that you're given, the choices of what treatment that you have with this. And I can only talk personally about what I've been through. If you catch this early, or in other words, if you've been having the blood tests and your prostate specific antigen count is going up from the normal 2.5 up. Mine was 14 point something at the end, but if it's even going 3 point something, 4 point something, then your doctor can monitor that, and you can have other treatments, radiotherapy. There's a whole host of other treatments. So I'm only here today to talk about my own personal experience. This was when I haven't mentioned the fact that all my life I've been a drummer and a percussionist. And in 2007, when I was diagnosed, and I said in another talk, I had no symptoms with this. You know, the Sunday before I went in for my operation, I played an out-and-out kind of jazz rock gig at full tilt, and I was doing that 4 nights a week before my operation, and I didn't realise how fit it was keeping me. You know, and when they cut you up down your stomach, they cut into all the muscles, and at that age, and then especially with, and this is the next thing, I went on to female hormone therapy. I couldn't exercise because I was in a lot of pain, and I didn't want to take kind of really heavy medication because I taught myself that if I take really heavy medication, then it tells me I can do stuff that I can't, and I end up back in hospital, and I've done that a few times. So that's when I was put on a Zolidex implant, which is a little slow release implant that they put in your stomach, and for a time I also had the Ciprotrone booster jabs in my bottom, which the lovely district nurse used to come and administer on a daily basis to start with, I wouldn't wish female hormone therapy on any man, to be honest. And again, here's a reminder, you know, go and have those blood tests because you don't want to go through this, believe you me. You know, I can't sing like Dolly Parton, but I physically, if you understand what I mean, you know, I've got bigger breasts than Dolly Parton now. And a very big bay window over the toy shop. I put on a lot of weight. So in the end, what I chose to do, and I went to see my surgeon, because really what this is about is testosterone and estrogen. Estrogen for a man is a therapy which does suppress cancer, and it proved with me because I did have a scan and my cancer had moved up to my chest, in the sclerotic region of my chest, and I was told that it was only a matter of time that, and then it would get into the bone and I would die. That was it. I was told I was going to die. But with the really, really strong female hormone therapy, miraculously that just disappeared. And that, for me, that's a higher power thing. I didn't want to keep on taking the female hormone therapy because it fuzzes you up and it's not good for your head. So what I decided to do is go back to my surgeon and ask him to remove my other testicle, which is what he's done now, and so therefore now I'm producing my own estrogen. You know, in fact, I'm probably more woman than any of you men or women. So again, and that kind of brings me up to today, although I've had a couple of little colon scares. That brings me up to today. And so again, if you want to avoid any of that stuff, the physical stuff, in my next talk I'll go on to the psychological side of this. But just on a physical basis, I've been through a lot of pain, and I'm still in a lot of pain with the consequences of 5 really big operations. So please go and get that blood test, no matter what age you are, every 3 months, 6 months, or a year. Thank you, and I'll see you in the next talk.